Hi, my name is Laura Guerra-Cardus. I'm with the Children's Defense Fund of Texas, and thank you for the opportunity to comment. As a child organization, our utmost concern is the health and well-being of children. And after some consideration, we are a child organization, but we have decided to fully support extending Medicaid to low-income adults because of the strong research linking parent coverage to improve child health. Studies and experience in different states show that when parents have health care coverage, children are more likely to get enrolled, stay enrolled, access care, and have improved family well-being. I included some of that data in the written testimony, but for example, low-income families with uninsured parents are 3 times as likely to have a child who's eligible for Medicaid but not enrolled. Today, only 225,000 of the 2.5 million children on Medicaid get health care coverage through Medicaid, and it's pretty safe to assume that most of those other parents don't have health care coverage. They're working low-income jobs, minimum wage jobs, and those jobs usually do not offer health coverage through the employer. Medicaid expansion could change this. We do recognize that there is cost growth in the current Medicaid program, but feel it's very important to remember that the majority of that growth is because we are doing a better job of reaching and providing health coverage to Medicaid-eligible children. There's also a finite number of children who are eligible for Medicaid, so as we approach and get more of those remaining eligible unenrolled children, we should see the cost of our current Medicaid program stabilize. In terms of cost per enrollee, Texas still spends below the national average per participant. As for the Medicaid expansion, we believe that we're not going to get a better deal than this to provide access to coverage to 1.75 million Texans. You already know the numbers, and the kind of matching rate that we would be getting for this far outshines most, if not all, other state-federal partnerships that we're currently engaged in. The last document in my packet is a comparison of other programs that we're a part of and how this match rate compares to those. The Perryman report shows that investing in Medicaid expansion would generate more revenue than the state dollars we would put into it. And finally, we would like this committee to know that we are supportive of cost, efficiency, and containment strategies, but we do feel that this can be done by finding some way to provide access to coverage for all citizens in our state. Thank you.
You know, I guess even if we don't expand Medicaid, the cost will be there in taking care of those Texans who are uninsured, and that cost will be borne usually by the local governments.
By local communities. And there was a great presenter at a One Voice conference that really talked about extending coverage to these low-income adults is really all about a preventive health care program for this group that currently doesn't have access.
And the $74 billion plus it's our tax money, and if we don't expand Medicaid health care, I guess it will go to other states.
Someone else will, yes.